Here are a couple of disorders of stomach motility that you should be aware of. The two are dumping syndrome and pyloric stenosis. So dumping syndrome usually happens in patients who have had part of their stomach removed, either a partial gastrectomy or a vagotomy, and particularly when the pylorus is involved. What happens is they lose control of their gastric emptying, and so after they eat food, particularly a large meal, it gets dumped into the small intestine. And the main issue with this is that it's a large amount of food that's osmotically active. It's hyperosmotic, and it pulls the fluid from the blood into the intestine, and you get osmotic diarrhea as a result. And so these patients have to eat small amounts of food over a period of a day in order to avoid a large osmotic insult to the small intestine. This can also happen actually as a result of diabetes, the cause of which isn't, and certain medications, the cause of which isn't quite sure. Pyloric stenosis is something that happens in newborns, and this is where the pylorus is long and creates a high resistance area for flow in the GI tract. This is a barium image of a pyloric stenosis. You can see the stomach here, and then this long pyloric sphincter to the small intestine. And the result of this is that it's very difficult for them to hold food down, and particularly after eating, the children will projectile vomit. This is fairly easily fixed by surgery with good prognosis, and it affects about 1 in 1,000 children. And the risk factors for it include cesarean sections, bottle feeding, but the cause isn't quite known. This, in contrast, then, is a normal pyloric sphincter. It's not nowhere near as long and not quite so narrow.